Okay, here we go. Surgery, the full Monty, the whole enchilada, the really big deal. What I remember about surgery, not a thing. Not a thing. I remember before surgery, and I remember waking up and different things afterwards. It's real spotty, but you don't remember anything from the time the anesthesiologist tells you, okay, now just relax, and then it's lights out and you wake up later. It's difficult to describe what's going to happen to you during surgery because it's very technical and different surgeries are done different ways, so I'll just be very general. There's a couple ways of doing surgery on bypass grafts. One of them is an on pump and the other one is an off pump. The on pump is when they clamp off your major arteries, insert some catheters into those veins and arteries, and basically bypass around your heart, taking your blood, cooling it, oxygenating it, recirculating it, putting it back into your body downstream of your heart, and you have a lung machine that is helping you breathe. You're anesthetized so much that were they to stop the breathing machine, you would die because your lungs aren't working. So you have something that's pumping your blood for you, the artificial heart pump, and you have something that's breathing for you, and that's the artificial breathing device. During this time, they will make an incision in your leg, and also once they have your chest opened up, they will take an artery that's an extra one called a mammary artery that's inside your chest and use that for some of the grafts. They will remove some veins from your leg if they do it that way. If they do an open chest, they will make an incision along the center line. They will cut your ribs, they will open your sternum and go in through that. At other times, they'll make an incision back here, and they can go in through the ribs and do an awful lot more and more as we go, as we speak about doing things without fully involving the chest. There's so much endoscopically, which is done with little cameras and little devices that they put through a hole in your side and do all kinds of things now, from knee to gallbladder to shoulder, even appendix, different things where you have a little bitty scar and you used to have a big old scar. So they open up your chest and they work on your heart. In my case, they removed my heart, put it on a table, worked on it, did all the stuff they were going to do to it, put it back in my chest, sewed it back on, started the pumps, and then they just essentially do a jump start with some electrical paddles that restart your heart rhythm, and they'll keep doing that until they get a satisfactory rhythm pattern, and then they close you up. They put a couple of tubes right here, 2 of them, and sew you up, and now you go on to PACU. That's post anesthesia care unit, commonly called recovery, which is where they watch you and where they let you regain consciousness. You may be in there from half an hour to an hour and a half, 2 hours, just depending on you. You're probably not going to remember any of it because you're so woozy when you come out of it, and they do take you to ICU. I don't have any memories of recovery at all. The next step that you'll be taken to is ICU, intensive care. In intensive care, you will have a breathing device down your throat. You will have various different IVs. I still have a scar from my carotid intravenous catheter. You have things that are basically monitoring you and helping to keep you alive during this very critical time. Now, this is a very critical time, and yet 98–99% of the people who have gone through it have survived it, and it's a very, very, very common practice in the medical field today. In ICU, you will have a Foley catheter, that's a urinary catheter, and this will gather your urine, and this will be in probably for 2 days. They may take it out in ICU, they may take it out when you get to your hospital bed on the next phase of this study. I've tried to make this short and quick, and because it's just, you know, what can I say? You go in there, they put you to sleep, they open your chest, they fix your heart, they close you up, and you go down the road and it's time for the next one. It can get very complicated from there. As much as you want to read about this, there are all kinds of Google things that'll describe it. There's pictures, there's films, there's actual surgeries, there's all kinds of things. And the surgery is where the rubber hits the road and where things are going to happen. Now, I'm going to go on, and from here, if you want the short version, that's it. Surgery is surgery. You don't remember anything. You don't feel anything. It's over before you know it. You wake up, they give you lots of pain medicine, and you're flying somewhere over Cleveland for about 2 days until you come down and land in a ward. That's a short answer. If you want to leave us here, that's fine. Now I'll start and tell about my specific surgery experience. I was ordered to show up at 5 a.m. for a 7 a.m. surgery. Went in there at 5 a.m. They did questions and filled out papers and signed papers and all this stuff. They tried to get an IV going to give me some happy juice, and they couldn't, so I didn't get anything. I was white knuckle until 7 o'clock when they came and got me and wheeled me into the operating room. Very large place, a lot of people, and a very narrow, small stainless steel table. Well, I had to crawl over there by myself. They didn't slide me over as they do most of the time. I don't know why. Maybe it's because I hadn't had any happy juice. And it was narrow and it was cold. I remember that. And I just about said, "Wait a minute, I'm just here for a hangnail. You got the wrong guy. It's not me." You know, it was, it came close to chickening out and backing out. So I went over there, and immediately people descended upon me, and a couple of them took my leg, a couple of them took my arm, each leg. I had people all over me, splitting me up and tying me down and shaving me and doing all sorts of stuff. And then the anesthesiologist appeared, and this guy, if you remember the old Addams Family, Lurch, it was like Lurch the butler plus 150 pounds. He was 7 feet tall, had hands about that long, and had the same voice as Lurch. I remember this clearly because I had absolutely no drugs at that time. I'm Dr. Brown, whatever. I'm your anesthesiologist. And he took my hand in his, and my hand looked like when you take a 2-year-old child's in your hand. And I thought, oh man, I bet he uses big needles too. So he took my hand, he said, "I'm going to put a little IV in here, and we're going to get you going, and we're going to get you calmed down." So he put a small needle in my hand, and I did not feel a thing. Didn't feel a thing. And he said, "Now I'm going to give you something to relax you." And I figured I'd be awake for a while, you know, and "you" is the last thing I remember hearing. And I was gone. I woke up almost 9 hours later in ICU, and I had the breathing tube. It's aggravating. It's only in there for about 24 hours, sometimes less. Woke up in ICU, and all I remember about ICU is just a lot of beeping and noises and things such as that. I remember the breathing tube. It was uncomfortable. They took it out rather soon. I was there for maybe a day. Then they took me down to the ward, to the regular rooms, and that's all I remember about ICU. The good thing about surgery in ICU is that it's a blur. You're not going to remember much, and it's different for everybody. They give you plenty of pain medicine. They give you plenty of medicine if you're anxious, if you're excited, if you're nervous, you know, whatever. Just tell them, and they're going to give you something. It's just going to make you float over Hawaii somewhere. You know, you're going to be really relaxed, just like you're on a vacation. So whenever you have problems, or if you experience something, tell somebody, and they'll make it better one way or the other. Surgery, post-anesthetic care unit, ICU is where it all happens, and yet it's kind of anticlimactic because you're not going to remember hardly anything at all. And the longer you get past surgery, the more and more and more your brain forgets all these things, and it just goes into the past. So that's the good news. And that's all there is to do about surgery.